Thank you for tuning in to Amaris B podcast. I am Dr. Ivan Puah, and I founded Amaris B Clinic in 2004. I am an MOH accredited liposuction doctor and medical aesthetics doctor based in Singapore. I have been trained directly under Dr. Alfredo Hoyos and Dr. John Millard for basal liposuction, Dr. Pierre Fournier for liposculpture, fat grafting, and thread lift. Also by Dr. Delgado for dedicated surgical training in gynecomastia surgery in San Francisco.
Today, we are going to talk about breast fat grafting versus breast implant. So what is actually fat grafting to the breast? It actually involves harvesting unwanted or excess fats from parts of our body. Let's say, for example, harvest fat from your abdomen, thighs, arms, any part that have excess fats. Fat can be harvested from these areas and then undergo purification to preserve the integrity of the fat cells. And the purified fat can be transferred to the breast area to produce the shape and the size that we desire. So this is actually fat grafting. Breast implants, however, there are two types of breast implant mainly. One is saline implant, the other type is silicone implant. Most doctors and patients nowadays perform silicone implant because it looks natural and it lasts longer and is safer as well. So what are the advantages for breast fat grafting versus breast implant? Let's talk about fat grafting to the breast. So what is the advantage of breast fat grafting? First of all, it's natural and safe. Unlike synthetic fillers or implants, breast fat grafting poses no risk of allergic reactions or rejections as it utilizes patient's own body fat. And the next advantage is that it looks natural and long-lasting. Patients who undergo fat grafting to the breast often have high satisfaction with the natural and soft breast enhancements. Fat grafting to the breast often requires harvesting fat from a different part of the body, and this not only enhances the breast volume, but also simultaneously reduces fat from donor sites, contributing to a well-contoured and slimmer body. Since patient's own fat is used, results are tailored, ensure a unique and natural appearance that complement each individual. When comparing with breast implants, breast fat grafting can often increase one breast cup in size on average, versus breast implants, which, depending on patient's request, can increase several cup sizes. Breast fat grafting often feels softer and natural, while breast implants often feel firmer with more distinct outline. Downtime is minimal, and patients usually can get back to the normal activities within a few days, while those with breast implants, a full recovery usually take about 2 to 3 weeks. There are certain risks that link to breast implants, including infection, rupture, capsular contracture, scarring, so on and so forth, while breast fat grafting has fewer post-operative complications. For breast implants, the implants will often need to be placed through an incision either under the breast or in the armpit. So it often lead to prolonged healing and sometimes lead to scarring, which can be visible after years. Compared to breast fat grafting, we just need a keyhole incision to place our cannula to get the results done. So implants are not meant to last forever. So after perhaps 15 years, 20 years, a revision is required to see whether they need to remove or replace implants. This is a thing rather than they're not happy with the results. If you put implants in, you may think that it's for life, but then it's often not, because implants are not meant to last forever. So after a period of time, you need to be assessed to see whether the implants need to be removed or replaced. So you're looking at another surgery, possibly in future, to assess the implants. The main cons of fat grafting to the breast is that it's difficult to achieve multiple cup sizes increase in breast cup. On average, most patients will achieve between 1 to 1.5 cup increase in breast size. However, for those who wish to have bigger cup increases, fat grafting can be done in stages. Okay? There are certain myths that I would like to debunk around breast enhancements. First of all, can drinking milk and eating yam, nuts, flax seeds make my breast bigger? Unfortunately, no. No food or eating plants can have been clinically shown to enlarge breasts. Any food that purposely helps increase your cup size is anecdotal. Does massaging breasts help them grow? Not really. Breast growth is influenced by multiple factors: genetics, nutrition, hormonal changes. Massaging or not will not affect your breast size or shape. Are there pills that make your breast grow? Birth control pills generally do not affect breast sizes. Changes occur during a menstrual cycle, which may occur acyclical. Can you exercise your way to bigger boobs? Toning workouts such as weightlifting or push-up only serve to tone out the muscles. It is important to remember that muscles and fat are two different components together, so there is no way to increase breast volume via workout.
Thank you for listening. I hope you enjoyed the podcast today. If you do have any questions, please feel free to send it to us. We'll be glad to answer all of them. See you again.